This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team. Evidence has shown us that moisturizing diabetic feet will reduce foot problems. The disease process of diabetics affects the feet. We can reduce the complications associated with the feet by the self-care practice of moisturizing. What causes dryness in the diabetic foot? Dryness can be caused by autonomic neuropathy, high blood sugar, medications, abnormal pressures, shoes, soaps, soaking, and aging. We will look at these in the following slides. Diabetes affects the nerves. Diabetic peripheral neuropathy causes diabetics to lose feeling in the feet. There is another neuropathy that can affect the diabetic. This neuropathy is called autonomic neuropathy. Autonomic neuropathy has many complications, but the one we are concerned with now is the loss of the control of sweat and oil glands of the skin of the feet and legs, which moisturizes the skin. So we have decrease of sweating and oil production, which causes the skin to dry out and become rough. This can lead to a break in the skin. Since the immune system of people with diabetes is adversely affected, it is easier to get an infection from this break in the skin, which then can lead to a difficult to heal wound we call an ulcer. Poor control of diabetes with high blood sugar spills excess sugar into the urine, and then the sugar pulls water with it, thus drying out your skin and making you pee more. Medications can also cause dry skin. Medications such as diuretics, which are also known as water pills, medications such as cholesterol, blood pressure, and acne may cause skin dryness. Abnormal pressures can cause dry, callous feet. Intrinsic pressures are pressures from inside the foot, such as deformities of bunions, hammer toes, and high arches, that put increased pressures on the ball of the foot. These might be due to a motor neuropathy. Extrinsic pressures are pressures from outside the foot, such as an unknown object in your shoe that you can't feel because you have lost feeling in your feet due to diabetic peripheral neuropathy. Shoes are of supreme importance to people with diabetes. Shoes can cause problems that will cause your skin to dry out. Improper footwear, such as worn out shoes, wrong size shoes, shoes that cause local pressures or friction, and shoes that don't breathe, all can cause your foot to dry out. Soaking can rob the foot of its essential oils and therefore dry out the foot. Soaps can cause dryness to the diabetic foot. Soaps with harsh chemicals, perfumes, dyes, or residues that stay on the foot can dry out the diabetic foot. Choose your soap wisely. Loss of moisture to the diabetic foot can be due to the normal aging process. Moisturizers aid the skin by absorbing water, smoothing the skin, blocking water loss, renewing the skin, exfoliating, and replacing skin oils. My own judgment reveals that creams tend to be more moisturizing than lotions. You can have your doctor help you choose a moisturizer for your foot. Moisturizers are good care for the diabetic foot. You can choose Amlactin Daily or Amlactin Foot Repair. You can choose Eucerin Dry Skin Relief Lotion or Cream. You can choose CeraVe Diabetics Dry Skin Relief or Hand and Foot Cream. You can choose Gold Bond Diabetics Dry Skin Relief Lotion or Foot Cream. You can choose Vaseline or Vaseline Intensive Care Advanced Repair. You can choose Bag Balm or you can choose 100% lanolin. Amlactin lotion is a deep moisturizer that smooths and softens rough, dry skin and helps renew the skin. It is recommended by both dermatologists and podiatrists. Amlactin foot repair foot cream therapy is ideal for the tough, rough, dry skin of the feet. It is a rich, concentrated cream that softens plus restores specialized skin of the feet. Amlactin is clinically proven therapy. Eucerin Diabetics Dry Skin Relief Body Lotion is specially formulated to leave the skin feeling healthier and hydrated all day long and will moisturize and soften dry skin. Eucerin Diabetics Dry Skin Relief Foot Cream smooths dry, scaly skin on the feet and heels. If you note that on the packaging, it notices that the cream is richer than the body lotion. CeraVe Diabetics Dry Skin Relief Moisturizing Cream moisturizes the diabetic's dry skin. It helps soothe the dry skin at application and is long-lasting for about 48 hours of hydration. It has products that retain moisture and attract the moisture and is gentle on the skin. It is free of fragrance and it has products that help restore the skin barrier. CeraVe's Diabetic Dry Skin Relief Hand and Foot Cream moisturizes and helps soothe the diabetic dry skin at application. It is similar to the moisturizing cream, but appears in my clinical observation to hold the moisture in a little bit better. Gold Bond Ultimate Diabetics Dry Skin Relief softens dry, rough skin with 24-hour hydration. Gold Bond Ultimate Diabetics Dry Skin Relief Foot Cream reveals that 9 out of 10 people with diabetes saw noticeable skin improvement in 1 hour. Vaseline 100% white petroleum is an inexpensive way to hold moisture in. Vaseline Intensive Care Advanced Repair Healing Moisturized Lotion can transform skin from very dry to healed in 5 days. Bag Balm has been around for many years. It can soften dry skin. When I tried Bag Balm, it was more effective than expected. Lanolin is an oil that locks in moisture by preventing water loss to treat and prevent dry skin. Lanolin can reduce water loss through the skin by 20 to 30%. Lanolin is a moisturizer that is most similar to our own skin oil. Lanolin has antifungal and antibacterial properties that protect skin. Moisturizers help to lock in the moisture in your skin after the water has been absorbed during the washing process. If you have very dry skin, then moisturize several times a day to keep your skin soft, smooth, and supple. Supple means the skin can be flexible rather than tear from the dryness. Moisturize daily. The best time to moisturize your feet is within 3 minutes after you wash them. Pat dry your feet after you shower or bathe. Leave your feet a little moist to help the moisturizer, but be sure to dry completely between your toes. Then apply a small amount of oil, ointment, cream, or lotion, and massage it into the skin. And put on your socks and shoes right away so you don't slip. Do not apply oils, ointment, creams, or lotions between the toes. You might cause an infection that way. For very dry feet, at bedtime you can apply a generous amount of moisturizer to the feet before slipping on a pair of breathable cotton socks. In the morning you should remove the socks and rinse the feet. For intensive moisturizing, you can wrap saran wrap under your socks and that will hold the moisturizer in overnight. And remember, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe. If you have any foot moisturizing techniques, put them in the comments section below.